Welcome to the Rewilding Womb, a space where birth, body wisdom, and feminine power are remembered and reclaimed. I'm Sabrina, an out-of-hospital midwife devoted to physiological birth, deep listening, and protecting the sacred threshold of pregnancy, birth, and postpartum.
And I'm Danielle, a photographer and doula, here to witness, support, and document the raw, transformative journey of being a woman. Together, we're having honest conversations about birth, postpartum, boundaries, and what it means to return to our instincts in a modern world.
This is the Rewilding Womb, where we trust birth, honor the mother, and come home to ourselves. Welcome to another episode of the Rewilding Womb. Danielle and I are here today with Olivia Rousseau. She's a local pelvic floor therapist, and she is serving women over at Revive, along with Sarah Miller. And we think it's really important for women to understand that pelvic floor health is so important to all women. It doesn't matter what kind of birth you've had, if you have symptoms, if you don't have symptoms. Every woman could be benefited by pelvic floor therapy. So we're going to just let Olivia tell us a little bit about herself starting out, and then we'll delve into specific questions that we have for her. So tell us what got you started into pelvic floor therapy and how you feel like it's really impacted you from the provider side of what you've seen it do for women.
So I've been doing a pelvic floor therapy, physical therapy for about 5 years. And prior to that, I was kind of a non-traditional student for PT school. So I had a yoga studio back in Illinois on like an alpaca farm and worked as a receptionist at a PT place, and through yoga, realized that I wanted to do something a little bit more physically oriented, and I'm really drawn to like healing yourself from the inside out. And so kind of pelvic floor therapy especially fits really nicely with yoga and with breath work and with like mind-body connection. So I decided to go to PT school. At that point, I didn't really know I wanted to do pelvic floor physical therapy. Hadn't even heard of it. And then in PT school, there are a couple clinicals that you can go on that are pelvic floor clinicals. So I decided, well, I'm open to that. I don't really know what it entails, but you don't learn any of that in PT school. You have to go on a clinical and just learn from someone through tradition, basically. And then seek continuing education kind of on your own and then learning as you go. So I attended a conference on just physical therapy and went to all the pelvic floor talks. One was about like body positivity of the vulva, and everybody that was there was so cool and looked amazing and just was like a little bit of a different type of person than your traditional PT. And I was like, okay, I feel at home, and this is like a really nice message. And then had a clinical in it and realized this is so important. You're working with women, which overall is just important, I feel like, because we're really underserved. And kind of demystifying a lot of your own healing that you can do. So I was just really drawn to it after being exposed to it and was like, somebody needs to do this, and I feel like I love it. So I'm not looking back, really.
That's great. Yeah. That's great. You've recently shifted, though, from within the medical system, providing this type of physical therapy to women, to now you're more in a private practice. Mm-hmm. And do you care to talk about that?
Yeah, I'm happy to.
Yeah.
I mean, I learned a lot while I was working in the system in Colombia. It's just by nature, insurance dictates a lot of like how long you're seeing somebody, what goals you're trying to achieve, and if those are important or not, quote unquote. Mm-hmm. And I don't think I really realized like how much that controlled and how much that fed into just the structure of where I worked until I left. And now I'm like, Oh, women are actually like wanting more support than just like 6 visits or 8 visits. And you're really just getting somebody an initial understanding of their pelvic floor in like 6 visits. So, I see people like starting to see people, some for a really long amount of time, to give them that initial awareness, then start a home exercise program, and then morph that and progress that until they feel like they're truly empowered. So I feel like being in private practice, I'm able to help females become empowered versus just like putting a Band-Aid on something, essentially. And so that's been really powerful for me as a person too, and my own nervous system and my own well-being, to feel like I'm actually doing something important. And obviously for patients and women too.
So are you guys able to bill insurance at all?
We're deemed out of network, so we don't do any of the billing, but people can submit it to their insurance. We'll give them what we call a super bill. And it outlines like our note, what we did, our goals, all of that, and like our charges. And then depending on their insurance, they might be reimbursed or they might not through that out of network benefits. So it's kind of a good, happy middle ground.
Yeah.
Yeah.
So kind of going back to pelvic floor, what actually is the pelvic floor? I think a lot of people, women, don't understand this when they think of pelvic floor therapy. They're thinking of like the elderly, like people, like, you know, having issues with prolapse and urinary issues where they can't control, obviously, their bladder. But it goes so much deeper than that. So I kind of wanted to have you explain what is the pelvic floor, and what are some things that people misunderstand about it?
Yeah. So first of all, for those that are just listening, you won't be able to see this, but I brought a pelvic model. And it shows the pelvic floor really well because it's like the basement to your torso. It's like the floor of your torso. It's really like a central part of your body. So it works together. It's a group of muscles that are essentially hip muscles, and they form like a hammock or a sling shape, or you might even think of them like a circular shape. They all work together. We can tease them out into different muscles, but that doesn't really matter because they work functionally with your breathing, with your core muscles, with your glute muscles, and your other like outer hip musculature. So it really functions as like a support mechanism for your pelvic organs, to your point. And supports like the weight of your baby in pregnancy and stabilizing your hips as they're then expanding to make space for your baby and to prepare for labor too. So they play a supportive function. They also act like a pump for blood flow, and that nourishes your skin and your tissue down there. That also can help with like arousal and sexual function. And then they obviously help with like urinary issues and bowel issues. So those are kind of our main categories for treating pelvic floor, for example, is any urinary issues, any bowel issues, just pregnancy, postpartum, menopause, every phase of your life as a woman. And then also pain. Pain's another big one. So like if you have pain with intimacy, or like hip pain or low back pain, a lot of us think of like our symptoms as just being localized to like where we're feeling it. But actually, often for women especially, we have a lot that goes on to our pelvic floors throughout our life, like regardless of whether or not you have kids even. So it's really more about getting the pelvic floor back to a functional place. How does that function with your hips? And is that causing some of your hip pain? How does that function with your core? And is that causing some back pain? So it's really all interconnected. And that's why I think I love it so much too, is that the pelvic floor like inherently is so holistic. When you treat it, you have to look at everything, not just like the muscles that I'm showing right now.
I'm looking at those muscles and I'm like already like doing Kegels.
I know. You're like, wait, can I connect to
these? Here, like, yeah, that's right.
Yes,
just like sit here. I mean, it's something I do too often. Like I'm sitting in the car, I'm just
sprinkle a few in.
Yeah, I do. It's just like a habit. I've like, yeah, it's it works for me. I've had
Yeah.
no issues with my pelvic floor and
That's awesome.
working on those muscles and everything. So I tell like my moms, like my clients too, like to prepare, like if they're not seeing like for a pelvic floor therapist, if they can't afford it or for other reasons, I give them certain exercises that I've researched and then send that over to them. But yeah, it's amazing.
Yeah.
And so like going to like talking about my clients, pregnancy, like why is it so important in pregnancy to have pelvic floor therapy? Because everyone thinks like after the fact. They think after babies arrived and like getting their pelvic floor back to normal. Yes,
Listen,
pregnancy is a huge thing when it comes to
I feel like if
birth.
I could get every pregnant woman to go at least for an assessment to get the feedback about how their pelvic floor is functioning, they'd have better births. And so often the first time moms are so resistant to these things.
Yes.
And so then after birth, it's like, you're gonna have to go see a pelvic floor therapist. And, then they've had this experience and then they realize maybe I should do this, but I think it's really important and almost should be. Eventually, it may be something that's just required. Like I might just say, you know what? If you're going to work with me, you're going to go for this evaluation at some point in pregnancy. Because I think the feedback is so important. But like you said, it's like usually it's after the fact something's happened and there are people, I can get people over there. It's like I have a pregnant woman right now, and not last birth, but the birth before that, she had a C-section. And all through last pregnancy and this whole pregnancy, I've been like, you need to go to the pelvic floor therapist. And she's just so hesitant. And I just know there's going to be so much benefit to it. And so it's hard for us to convince women, but tell us why it is beneficial as a preventative.
I think a lot of it just boils down to sometimes you just need someone to like really explain to you or touch that muscle and say like, here's where that muscle is. This is what it feels like to contract it. This is what it feels like to let it go, and train you through just like awakening awareness and body control over that part of your body. I think that's the most powerful part.
Totally agree.
So yeah, like Kegels are very important because that's one form of awakening awareness. And every Kegel involves a squeeze of the pelvic floor and a relaxed component of the pelvic floor, which is often missed too. So there's like certain types of Kegels I like to prescribe in pregnancy, but a lot of women just kind of like shut down in this area, especially if they've experienced any sort of trauma in their lives at all, whether it's sexual trauma, birth trauma, or even just anything else that makes you just kind of breathe funny because your nervous system feels like it's on alert all of the time. So a lot of it, again, that becomes like way more holistic. We are taking back ownership of this really intimate part of your body instead of just feeling like things have been done to it without your like consent or control.
And when you say that, being an out-of-hospital provider like myself, like every woman who's had a hospital birth needs to have pelvic floor therapy. You know what I mean? Because without consent or control, like that happens so often, even in like the most gentle hospital deliveries, and sometimes even in home birth deliveries, depending on the provider, there's things that are happening that women don't know about. So,
and in birth itself, like that's not necessarily the time to start connecting with your pelvic floor because it's like there's so much happening. Like that'd be great if you can in the moment, but for a lot of people, I feel like it takes practice. So, awareness is a big aspect. And then depending on if this is like your first kid or whatever symptoms you're having, or your second or your third or whatever, we are working on support of the pelvic floor in pregnancy itself. So like I see a lot of women in pregnancy who have like a lot of heaviness or sensations of prolapse. And that really impacts your ability to then be mobile through the rest of your pregnancy and take care of your family. So if we can kind of start that early, that's the better outcomes we have.
Mm-hmm.
So not only supporting pelvic floor, but also just staying active in core strengthening, hip strengthening, and not like succumbing to this. There's so much information online now that's so scary.
Yeah.
Or it's just like way too much information for us to process. And we almost need like a professional sometimes to say, no, like hone in on this truth. This is specifically what's happening with you. And this is what you need for your pregnancy. Or this is what I'm recommending. Like, do you agree also?
And that's really, really important because social media can be really hard.
Yeah.
It's like, take these supplements, do these exercises.
Yeah.
And we're always talking about individualized care.
Mm-hmm.
And that's what a true, like, in-person therapist is going to help you with. Like, this is your specific body. These are your specific issues. And this recommendation is tailored to you specifically. And your sister or your best friend might have completely different issues. So
Yeah.
don't do what they're doing.
Right.
Come see a pelvic floor therapist and get individualized care. It's really important.
And going back to when you said of workouts and hip exercises, things like that, I want to talk on like women that are very like love to exercise, but they associate that tightness with strength. And I feel like with clients I have seen, we have to work on relaxation with their pelvic floor because they are so tight. They hold those babies within and they have to learn how to relax and release those muscles because all they know of is tightness. So I kind of want you to talk a little bit on that with the different exercises that are recommended and things to kind of avoid.
As a pelvic floor therapist, like the number one exercise you usually start people with is just deep breathing for relaxation of the pelvic floor and for relaxation of like your core and your hips and your nervous system. It just helps with so much because if you are holding tension or you just, like have no connection to pelvic floor, we need those muscles to gain mobility before then they can use their full force too. So I think mobility and relaxation is good for everyone, not even just if you like know that you're tense in your pelvic floor. That is probably a piece of information that's shared online quite a bit. Every time you inhale, the pelvic floor should move like down and out in all directions. So you inhale into your belly and inhale all the way down into the bowl of the pelvis, and that stretches the pelvic floor. And so then that is like super important for labor too, as you all very well know, because when you're experiencing pain or a lot of sensations, a lot of us just stop breathing and we stop like belly breathing and low breathing. And so then our pelvic floor tenses too. So if we can like hit that before the intensity comes, then again, better outcomes. If that typically works, but it sometimes takes like a few visits or a few tries or a few weeks of like working on that on your own to stretch pelvic floor. Some people also just respond better to like moving their body to shake off that tension too. So then that's kind of where exercise can come into play as well. If you work on strengthening all these accessory muscles to the pelvic floor that work with pelvic floor, sometimes we get that like contract, relax. So you got to like feel the Kegel or you have to feel the core contraction and then you know how to let go. Because we don't know where we are at baseline. Like unless you see a therapist or something, or you feel on yourself. So the only way to know where we sit in that range is to do something either to relax pelvic floor or to squeeze it and then let go, if that makes sense. But yeah, that's step number one. Let go of the tension, especially for birth.
Yeah. I kind of want to, because we're talking about pregnancy too and the prepping. So when you say that you touch on a muscle, like what does that mean?
Yes, thank you. Yeah. So first of all, I just want to preface this with like, we don't ever have to in pelvic floor physical therapy do an internal evaluation or internal palpation or touch of the muscle. But that is like our best tool that we have if that is okay with the client and the patient. So it's kind of like going to the gynecologist, but a lot more comfortable, where we're not using like a speculum or any of these triggering things. It's just a glove finger goes in the vaginal opening. And that is really one of the only ways we can palpate or touch the pelvic floor muscles and see where they are at rest, how they behave if you do a Kegel, how they behave if you like try that relaxation exercise.
Okay.
And really,
Yeah.
that's because what is visible from the outside or that
Right.
can be touched from the outside
Right.
is only one layer. Why don't you explain that to us? Because I obviously know what you're talking about as a midwife and helping women like regain their strength after delivery, but explain that to people, because the vagina, the birth canal, is actually a tunnel of muscles. And so explain that to people so they understand why it is so beneficial to actually go ahead and do a little bit of it, that internal exam.
Yes. Okay. So yeah, the layer that you can see a little bit from the outside or even touch from the outside are the muscles that wrap around the urethra, the clitoris, the vaginal opening, that wrap around also the anal sphincter. So sometimes we can kind of get an idea of like, okay, let me watch you do a Kegel, or watch yourself do a Kegel, and do we see those muscles come in like a circle, kind of like your mouth when you're pursing your lips appropriately? And then when you try relaxing those muscles, do they move down and out? But you're completely right. That's the only layer that's really visible. There's two deeper layers that get closer and closer to baby, closer and closer to your pelvic organs, to your belly, to your booty, to your low back. So then there's this deep layer of the pelvic floor that actually is, I think, the best visual, because you can really see that circular shape. So there's the outer layer at the openings, a second layer you can't really see on the model if you're watching the video, and then this deep, deep layer. There's 3 layers. And they each have like their own functions in a way. Like you could be super strong and aware of that first layer that you can see, but then the other layers are like not kicking in. So there can be like a lot of nuance to it too.
And they all have to work in coordination to be functioning well and in a healthy way.
Yeah.
Yeah.
Yep. And I will say 2 more things about pregnancy as well. In pelvic floor therapy, we're working a lot also towards the end with that first layer that you can see on perineal massage or perineal stretching, to try to kind of stretch those tissues ahead of time and get used to the sensations of like baby crowning, practice all of that sensory awareness and ability to relax with that ahead of time. And then we also are checking people's ability to like bear down and push. We don't have you bear down like as strong as you might need to have a baby, but we would just want to make sure pelvic floor can get out of the way if you need a little bit of active pushing.
Okay. And then can you kind of talk to us about how pelvic floor therapy isn't just for vaginal births? I feel like a lot of these C-section mamas would love to hear about like what you guys have to offer for them.
Yeah. So as I mentioned before, the pelvic floor works in close conjunction with your abdominal muscles. And while most C-sections, they're not cutting through your abdominal muscles, they are cutting through your abdominal fascia, which is like maybe, I mean, I'm not going to say worse, but like it has a big impact too. That's super strong connective tissue that then you're disrupting the messages that it's sending you of how to work your core, how to support your pelvic floor then as a result. So with C-sections, we see a lot of people that have like urinary urgency afterwards, or who have like trauma and then they're holding on to a lot of tension too. So those I'd say would be like the biggest symptoms that people would notice after a C-section, but it's almost more important for C-section moms to receive that support because it is a huge surgery. And then you're expected to just go like take care of your family and this new baby and yourself and heal afterwards with like little to no support. It's nuts. Every other surgery orthopedically, for like if you got a knee replacement or you got a shoulder replacement, you would have PT prescribed. And I think part of the reason we don't do that for women is because we're assuming like those women are going to be so busy with their families that that's going to be like another layer of busyness that they don't want. You can't assume that for people.
No.
That's just another layer of putting women as second class people. Like, oh, they're not going to need any, what they need to tend to, everyone else's needs.
Yeah.
I feel like as a midwife over the years, I'm coming to realize I think women who've had C-sections need pelvic floor therapy more than the women who've had vaginal births.
Mm-hmm.
And for many reasons,
Yeah,
but I just see them
hard.
with way more hip and pelvic problems that their chiropractors can't touch, their massage therapists can't touch. And I think this is another problem with like saying, well, we're going to divide the body up in all these different parts. And, what we did to the lower abdomen has nothing to do with the pelvic floor. Yeah. It's like the body is a whole thing that's everything works together. And when you do that much invasive, like, procedure, it's definitely going to affect how the pelvis functions. And so some of those women, they get, it's like, it's frustrating.
And then going into that more, so the fascia work. So like you touch on that as well. And then tell me how that is something that is during birth, during labor, how fascia, everything's connected to the pelvic floor. We talk about the jaw, the face, the mouth, releasing tension in different parts of your body is part of that pelvic floor.
Yeah, I could nerd out about that for a long time.
Yeah.
So for those that don't know, fascia is like a connective tissue that forms webbing essentially that networks your whole body. So it wraps around all of your muscles. It infiltrates each muscle fiber and wraps around that. It wraps around your organs. So it's like a messenger essentially to give a good, and it truly is a messenger, to give your body good signals of, for me, like the biggest way that I work with fascia is how it impacts movement because I'm a PT, but it sends signals when you take a step forward to then like take your other step forward and for your whole body to work in synchronicity. So it's super important, very hard for you to work with on your own. Like sometimes you have to, again, touch that fascia, watch how it behaves functionally in an exercise to understand how then your like left shoulder is connecting down to your right groin pain. There are these fascial slings that are like these huge cross-body fascial networks that connect funky parts of our body to each other that you wouldn't think are connected, but actually are. And the same thing happens on like the back line of your body too. So you can kind of start small with like working on the fascia of the pelvis and the pelvic floor and how the abdominal fascia connects to like the pelvic fascia. And then broaden your lens from there. But yeah, fascia is probably more important than muscles too.
Absolutely. And then going back to scars, like C-section scars, again, talking about the fascia there as well and releasing certain areas with episiotomies or natural tearing even. So do you find it very relieving when you work on those scars or those women that they have like, wow, this feels so much better, like they don't feel as much tension? Like what are some things that you hear working with scars?
Yeah, I think easiest one to understand is a C-section scar. A lot of women come in purely because they don't like the appearance of it, but there's definitely other sensations that go along with that. Like I just feel like I have hip flexor tension or like hip tension that's just not going away, or my core isn't coordinating. It is nuts. We really need to take some before and after photos, or I could even do that myself, of a C-section scar at the beginning of working with it. And then after like maybe 2 to 3 sessions of really being intentional of working on the fascia and the scar, it changes so much. Because most of us have probably heard of like the shelf a C-section can create when you mobilize that with certain techniques with your hands, or you use cupping tools to help mobilize those deeper layers. it helps those tissues glide well against each other instead of acting just like a tight band all the time. And the same thing goes for perineal scars, whether it's an episiotomy or a natural tear that's then been stitched or naturally healed. That scar tissue is its own type of tissue. And we all just think, well, it just kind of heals the way it heals and there's nothing we can do about it. But it needs nourishment too. It needs touch to desensitize those nerves, to help those tissues glide, because scar tissue doesn't want to move, but it actually can be mobilized really nicely.
Yeah. Well, that's good. Good to know. And then for postpartum, like moving into postpartum. So what are some things that you can tell women, some warning signs to look out for after they've had their baby, that they should reach out to a pelvic floor therapist? Like, what are some things to look for? Yeah.
In the early days, I would say it is pretty common to feel like some heaviness or some discomfort or heaviness with pooping or peeing or sitting on the toilet or carrying the whole weight of your baby. That should naturally trend like away. So I'm going to say trend upwards as you heal. But if you're noticing that early on and you're kind of tracking those symptoms and it is saying persistent or getting worse or just very slowly getting better, that's a big early sign to watch out for. But definitely after initial days, you should not be peeing your pants, even with a cough, sneeze, laugh. You should not be struggling so much with low back pain, with hip pain, with pubic pain that you had in pregnancy too, or feeling disconnected from your core. Constipation is a huge one as people wean off of stool softeners. Then their gut is just reorienting to like not having a baby in there, and it all of a sudden has like room to work and it doesn't really know what to do.
Yeah.
Or some people are taking iron and they're constipated. So again, urinary, bowels, pain with sex. Once you do try sex, there's a big hormonal component to that. But it should not remain painful postpartum.
And that's what I was going to kind of talk to you about, hormones too, and that pelvic floor postpartum. And yeah, what are some things that some women would feel like with their hormones shifting, and how that does affect intercourse?
Can I ask another question first? Just backtrack a little bit. That when you talk about that pressure early in your postpartum, and you said it should gradually start getting better. Like, at what point do you think that a woman should not feel that anymore?
I mean, I would say I still feel pressure. Like, I just got over a respiratory illness, and with all that coughing, and I'm like 1.5 years out from my last baby. So it definitely takes many years to just feel like your new self or as close to your old self as you can physically. So give yourself like some grace. But if you're still noticing like significant heaviness just with like walking around your house after like 4 to 6 to 8 weeks, let's tackle that early. Because that does not have to happen. And you're still in that initial healing phase. So if we can get to it then that sets you up well for the rest of your recovery instead of like yo-yoing back and forth.
Yeah. Okay. I just wanted to clarify.
That's a good question.
Hormones.
Hormones.
Okay.
Talking a little bit on hormones.
So a lot of people have pain with sex, especially if they're nursing after having a baby. Otherwise, if they're not, then still just like that perineal scar area or C-section scar or just even abrasions and stuff can be a little bit uncomfortable. I can speak mostly to like if you are nursing, your body has lower estrogen levels, which is why doctors don't want you to get on like estrogen birth control. So that can make your tissue a little bit more brittle. It has a little bit of a harder time like bouncing back hormonally. It impacts sometimes your strength with bouncing back. So it doesn't mean you need to stop nursing, especially if that's what you want to do and it's working out well for you. But you can rely on like pelvic floor exercises, or therapy estrogen cream that you can put on topically if you're open to using a topical hormone, which is a lot more gentle than a systemic hormone, to reduce pain levels and help that tissue feel less fragile and sandpapery and raw and that sort of thing. Or a good in-between is to just use like a vaginal moisturizer. There's a lot of really natural ones out there that help just create like a good barrier and plump up your vulvar tissue. Because what happens in postpartum with that decreased estrogen level is the same thing that happens in perimenopause and menopause. Your vulvar tissue just gets like less hydrated, and that can in itself cause like some pain and discomfort and changes to your anatomy down there. So all of those recommendations apply also to perimenopause, menopause. And then the other thing I'll say about all of those states, postpartum, perimenopause, menopause, still low estrogen levels is what we're talking in those states. That can also impact feelings of prolapse and heaviness because your body then has just more like extra flexibility sometimes in those states. So you might notice that it takes like a lot more Kegel exercises, or it takes a lot more like strengthening exercises to feel like you're able to support your bladder or your rectum or your uterus or your pelvic floor.
Yeah. So like we're talking about like perimenopause, menopause, because I'm hearing a lot with women because I'm researching different things about all of that stage of life as I'm like, entering that stage as well. But also I feel like with menopause, they're given, these women are just given an estrogen pill to take. And it's a lot deeper than that because the estrogen medication can cause other issues that they're not talking about. So I'm glad that you kind of spoke on those types of things that you can use that would help. Well, how do you feel like with going into that hormonal shift? What are some other things women can do to help support their transition into menopause for their pelvic floor? Or even some women have had hysterectomies. There's a lot more women that are now having partial hysterectomies due to excessive bleeding, fibroids, lots, polyps, that's causing iron deficiencies. So when you see someone come into your office that has had a partial hysterectomy or a full hysterectomy, how do you usually work with them?
What's funny is that, like, if you look at those surgical reports, there's like little information on what was done. They're like, your uterus is gone, and that's what we did. And I'm like, okay, but where's everything else like attaching to?
Yes.
And so a lot of times the best information you can get again is just from like having somebody feel it or asking your doctor good initial questions. So after a hysterectomy, there's a lot of fascial work to be done and scar tissue work there too, which you have to be very tender with and very gentle with. But often that vaginal vault, like the top of the vaginal canal, essentially will have a lot of extra scarring, and that can cause pain with like a deep thrust with sex and stuff, for example. So that can change drastically just with a little bit of work to it. And then the rest of what we're working on often is from a hormonal state and a lack of support state, from not having your physical uterus there to kind of bolster your bladder and support your bladder and bolster your bowels and support your bowels. We're typically working at some point on some like Kegel exercises. And there's so much more than just Kegels that can be done too to help support, like just mechanically, how are you breathing when you're lifting up your like grandkids? Or when you're lifting your heavy purse, or when you're at the gym, how are you breathing? How are you using your core? So typically a lot of strengthening work and then a little bit of scar work after a hysterectomy.
Good. That's good to know. So I kind of want to touch base on one other thing. Is it's a little bit more, I wouldn't say that spiritually, but the emotional connection with our pelvic floor. And this can be from just trauma, stored trauma. We talked a little bit about sexual trauma, women have had to suffer from abuse, so sexual abuse, but also how other trauma is stored within the pelvic floor. And it doesn't even have to be, it can be emotional, physical. But like, what do you see there? And what are some ways to work through that? That you would recommend, and then kind of touching a little bit back on that sexual like trauma side as well, because that's what I want women to feel confident going into your these spaces, and say, I want to get this done, because sometimes I think that's a hesitant, like that's why they're hesitant to go in, because they're worried, like, or they don't know what is involved, even though they know this can actually connect them spiritually, emotionally to their body by going to see a pelvic floor therapist. So kind of touch on that a little bit.
Yeah. So if I'm seeing someone who has a lot of pain or who has like a known history of trauma, we're often just working on like breathing with no touch of anything, or like hip stretches, or maybe just like hip massage, and kind of like building a relationship, making sure they're feeling comfortable. They understand how these external layers of core and hips and all of that and nervous system work into pelvic floor. There's a lot of tools that we recommend to patients too, that then they can be in control of. So there's still a lot that we can do, even if somebody still thinks like the internal part is uncomfortable for them, too triggering for them, or just like weird in their mind. It has to do with like trauma-informed care, same as you would ask for from your gynecologist. Like there's tons you can ask for there too. Like, can we have lower lights? Can I insert the speculum? Those sorts of things.
Yeah.
We can use all of those sorts of tools. But if someone has sexual trauma, physical trauma, especially, or even like a car accident or something, that can definitely show up in the pelvic floor. Other less common ones, if we're kind of going through all the questions, I see a lot of people that hold tension in the pelvic floor because of the way that they were brought up and the language that was used surrounding their sexuality and surrounding that part of their body. So a lot of like shame-based messaging that can sometimes happen in like spiritual or religious circles, or just from your parents or what you were taught at school. So that's like another big one, is just feeling like this is a no-no area, and so we're gonna like disconnect from it entirely. And then other ones would just be like any impact exercise or any impact sorts of accidents, like I mentioned, car accidents or landing on your tailbone or things like that. But it all boils down to, how did that then rebound into your nervous system? And your nervous system ties directly into your breathing. So typically it's just that at some point you didn't feel safe down there or somewhere. Maybe mentally you don't feel safe. And so then you start getting into that fight or flight of like quick, anxious breathing into your chest. Your digestion slows down. Your pelvic floor tenses because it's never getting that big breath to let it go, to give it that like nice pumping action that it needs to be healthy. So that is like one of my favorite types of populations to treat, because it's so rewarding, but there's a big obstacle in getting there.
Yeah, absolutely. Okay, well, one other thing, if you can tell the audience, the women listening today.
I have a couple more questions.
Sabrina, go ahead.
So the first question is like, how long do you think a woman can be experiencing problems in her pelvic floor, say, because of a C-section and it never being addressed? Could it be like decades later and then she go for pelvic floor therapy and you guys are able to bring benefit to her?
Yes.
Okay.
Yes. Because women that are like in their 60s, 70s, even 80s, like usually, although we're still really behind the times with pelvic floor therapy and women's health and hormonal health and all of that, we are much better than we used to be in a lot of ways, but it's like still not enough. But women in their 60s, 70s, 80s, they did not get it. Like, they'd never heard of pelvic floor therapy. Nobody has ever looked at their scar. Nobody has ever touched their episiotomy scar or recommended certain exercises. Most of the time, all you ever hear is like maybe what you hear online nowadays, or your doctor said, oh, you're having pain, like do Kegels. And they never explain how to do it, or like if that's actually what you need. So although you're not in that like initial recovery process anymore, and you're decades past like whatever the trauma was or the injury was or your birth, that's another really rewarding population to work with, because I think a lot of people feel like they're too far gone and like nobody listened to them all these decades. And I still see people getting quickly better after just like several visits. And C-section scars can make amazing change after that point too.
That's great. That's very good to know.
Yeah.
That might be a little bit of a personal question. Yeah. The other question I was thinking of as you were talking just a moment ago was, women experience all kinds of different things throughout their life that then causes them that they are holding that tension in their pelvic floor. You mentioned a few, like obviously being violated sexually, or just living like in a shame-filled like environment, or accidents. So I'm just trying to think about, as women are in their childbearing years, is it possible for a woman to not be aware that she's having pelvic floor problems? Like the typical questions that I ask them, they might answer them all correctly, but something in my gut is like, she's got a problem with her pelvic floor. And so is there anything like we can create like an additional questionnaire that's like, if you've ever experienced any of these things in your history, you might be dealing with pelvic floor issues, even if it doesn't seem like you have those symptoms. One misconception, and I'm going to tack something else on just so I have a chance to say it, but one misconception I see a lot is women believe that pelvic floor problems means incontinence, and that's the only pelvic floor problem. I feel like as a midwife, I'm starting to see too tight of pelvic floors, not too loose. And those are the tight pelvic floors are the ones that make my job really hard in trying to get a baby out. And so I was just curious what your evaluation is when you're working with women. Do you see more too loose pelvic floors or too tight?
Tightness is always where we start. So it is still like really prevalent. In my initial training, it was that the thought in pelvic floor therapy was like, everyone is tight. And that's not always true. There's like certain populations I can almost put a generalization on, like in menopause, like most of the time we're not dealing with pelvic floor like tension as the main driver. There's always like multiple factors. But often on that first visit, a lot of people have pelvic floor tension, whether it's just from their response of like not feeling safe in getting an exam done. And that still matters for your birth experience too. You need to get into more of the habit of like, okay, what do I need to feel safe? How do I like tell my pelvic floor I'm safe? All of those things. So there are a big chunk of that large piece of the pie that has tension that gets better pretty quick. But there is still like, significant tension that we're dealing with as a whole, I think, because we're all just living in this like Western society where we're just like, go, 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 go. And everything has to be perfect. And so that like patriarchal mindset and capitalistic mindset just like also causes pelvic floor issues, because you're feeling like everything has to be controlled and everything has to be rushed. And that nervous system bleeds down into pelvic floor too.
Yep, that's what I see a lot of. Yeah. So then back to that list of things we could add to a questionnaire of like history.
Yeah, that's what I was going to ask too.
Yeah.
That's what.
Yeah, we have a pretty lengthy intake form, and we've already covered the big categories so far here. But other common ones to really try to like tease things out would be like, do you have tailbone pain? Or did you ever hurt your tailbone even when you're a kid, like landing on your bike or something?
Yep.
Even just feeling like you constantly have like awareness of your bladder or your pelvic floor or your bowels or your gut, just feeling like that area of your body is always like on edge. Like maybe you have a urinary frequency and urgency, but then when you go, like you don't have a lot to pee out. Those are kind of like less common categories. So you could ask about those. And I think for like pregnancy and postpartum populations, especially, asking about like, does something just feel like different down there that bothers you? Like maybe you're not having a lot of pain with sex, but it feels different than before, or like your libido is different, or you can't orgasm the same way. Or like you don't notice your pelvic floor at all or any hip or back pain or anything, but then when you like squat down, you just feel funky there. It's hard to ask like a targeted question, but if something just feels different, a lot of people don't want to feel different than they used to, and you don't always have to settle for that. So for postpartum especially, that's a good question.
Yeah. Okay.
Yeah.
It's great stuff. Good information.
Well, I appreciate you sharing this information with us.
Yeah.
This is great. And hopefully we got, multiple women listening to this, and then the pregnant women or, women going through menopause, reaching out to some local pelvic floor therapists in the area. And Olivia is great. She is a past client of mine. I was her doula at her birth, and she was just absolutely amazing.
Oh, thanks.
And just watching her journey and through this business and helping the community has just been heartfelt for me. So yes, we appreciate you being here today.
Yeah, thank you so much.
Thank you guys for what you do too.
All right. Well, we'll see what's coming up next week. And
next week we have mental health.
We have mental health. Yes, we're diving deep into postpartum and anxiety, depression, and our moods. So that's gonna be a good talk.
Yep.
Good chat.
See y'all next week.
Ya.